Hey everyone, and welcome to the Balanced Bodies Blueprint. I am your host, Vinny Russo.
And I am your co-host, Dr. Eryn Stansfield.
And we're shifting gears from all the conventional fitness narrative you hear on most fitness podcasts, as our main emphasis lies in preventative healthcare, adopting a holistic approach to nutrition, and challenging the traditional views on various fitness topics.
Our mission with this podcast is to provide you with the information you need to achieve optimal health.
And on today's podcast, we are going to be talking about sarcopenia and the essential steps that you should take to actually prevent it from occurring later on in life. Dr. Eryn is going to be taking the lead here as she's got some evidence-based data to present to us and some pretty good steps that we all should take into account because as we age, it seems like this might almost be pretty inevitable.
Yeah, so let's first define what sarcopenia is. Sarco means flesh and penia means poverty from Greek, but essentially it's about muscle loss. So we're going to talk about different studies, and really the big question here is should doctors be routinely screening for sarcopenia?
Oh, I'm going to just say right off the bat, asking our audience this, I think most of them probably don't really know. And that's not an insult to their intelligence, but it's not something that's really routinely talked about. So I'm going to say that most people might not even know what sarcopenia is to even ask that question to their doctors.
Yes, that's an excellent point. I think most doctors may not even know what it is themselves. It's become more recently discussed. But basically it's muscle loss, especially it is a medical condition. So there's a certain amount of muscle loss that can occur as you age, but there's certain steps that can be done to prevent that. Muscle loss and function can be attributed to mortality rates. So the more loss of muscle you have as you age and the less function you have increases the risk of, let's say, falls, for example, which is one of the biggest risks of mortality in the elderly population. So we're talking about, a whole range of years here. A recent meta-analysis of 56 studies, mean age of 50, so, relatively young, found a twofold increase in risk of mortality in those with sarcopenia versus without. So it does increase your mortality rate if you do lose muscle over time, especially at the age of 50. That's fairly young, especially since we're living longer these days.
Well, if this is relatively new, is it diagnosed often then? Like you said, maybe even some doctors might not even really know about it.
Yeah, it's definitely underdiagnosed and undertreated. I think it's become more popular or more looked at as the population has lived longer. So, people are now living beyond their 70s into their 80s, 90s, and sometimes if they're lucky into
hitting those 3 digits. Yeah.
So I think now we're kind of looking at populations that live longer and why they live longer, and this has been highlighted. So, when we talk about what we can do when we're young and, not in our 50s and maybe in our 20s, 30s, 40s, what can we do? The easiest, most logical prevention strategy is strength or resistance training. That doesn't have to be crazy hours in the gym. You don't have to be some athlete. I want to give you some numbers though here just to give you an example. 1 session per week of just resistance training over 10 weeks can increase your lean body mass by 0.33 kilograms. If you up that to twice weekly, you can gain lean body mass up to 1.4 kilograms over those 10 weeks. That doesn't take into account protein intake. So you may have more muscle and muscle preservation with increased protein intake.
Yeah, and if you're listening to those numbers, they might not sound like much, but just consider how little effort that actually is to have that, right? And those gains are actually very encouraging. Now this is all going to be dependent, right? Like if you have someone who is training often, then happens to stop and then goes back to it, they might not see that significant increase. And we call it significant because, if you look at it over 10 weeks, it can be pretty significant. But this raises a pretty interesting point here. like, because especially with what you just mentioned at the end, if someone's diet lacks sufficient protein, they might just be spinning the wheels and getting fewer benefits than what they can actually expect. So, Dr. Eryn, from your professional opinion, would you say most people are underestimating their protein needs? And I'll give you my thoughts after you give yours.
I think most people don't even know where to start in calculating their protein needs, right? That's something that a nutritionist should help with. And also, I think as we've become more educated, we do find that we know that the RDA definitely has recommended protein, and the protein recommendation is under what people that are active, and if they want to build muscle, it's too low.
Yeah.
So,
Well, before you continue, just my thoughts on it quickly. I'm going to say that it is very underestimated. Just if you think about like protein in general, it's hard to overeat protein materials, protein foods, especially unless you're like a steak guy, right? And then you could have like that 40-ounce tomahawk steak and you could overeat there. But the general population is not going to overeat protein. It's very satiating. One rule of thumb that I like to say, because calculating it is one thing, right? But one rule of thumb is just eat protein with every meal. And you should be getting sufficient amounts by hitting that rule of thumb. So if you eat 4 meals a day, all 4 meals should have some protein source, even if you're snacking. If you count those snacks as one of your meals, then you should have some type of protein with that, whether that's a hard-boiled egg or two, whether that's a protein shake with your snack, whether it's Greek yogurt with a little protein powder thrown into it. Just always make sure that you're eating protein with every meal, because I do feel like it is underestimated with how much people actually consume on a daily basis, because how hard it is to, number one, overeat protein. And number two, if you think about snacking on stuff, you're not thinking about going into the fridge and grabbing a chicken breast. You're going to think about maybe grabbing like a handful of granola or a handful of nuts. So yeah, I do think it is underestimated.
yeah, and I've said this before on other podcasts, but if you want a very, very rough estimate and you're into math, you can say adequate protein consumption is roughly around 1.5 to 1.6 grams per kilogram per day. But I know Vinny probably doesn't like that because he actually calculates each client's protein intake and like how much they weigh and how much activity they do. But that is a very, very rough number.
Yeah, there's a podcast episode. I think it's 1 or 2 episodes back where I actually talk about it. So if you haven't listened to that, go back and listen to that.
All right, back to resistance training though. So you don't need an expensive gym membership or fancy equipment. People can do this at home, especially we saw this during COVID. I think a lot of people couldn't go to gyms. You can get some resistance bands, some free weights, and even strength training machines are all great. Anything that you can think of to, even your body weight, you can do body weight lunges, that sort of thing. Will increase muscle mass.
I got a funny story actually about the whole COVID thing with resistance bands. So I was in prep during COVID, and one of my things that I like to do was go to the beach and just walk the boardwalk to get some steps in. And it was at the tail end where people were actually starting to like get out a little bit more. And it was in the summertime, and I'm at the beach, and there's this group of young 20-year-olds, and they're all like messing around with each other. And I am doing my power walk, and I'm walking by, and I got my shirt off and stuff. And one of the kids goes, "This motherfucker got every resistance band known to man at his house right now." And it was just funny because can you get a body like that with resistance bands? I mean, if you have the right resistance bands, you definitely can.
And
you
genetics.
Yeah, and genetics too. You don't need to, like she said, you don't need to go to the gym. Worst case scenario, if something like COVID were to happen again, invest in resistance bands. It's always good to have on them. And sometimes you just want to not go to the gym. Maybe you don't want to see someone that you keep seeing there, they keep talking your ear off. So you stay home and you actually use resistance bands. You can get a really good workout. You really can. It's just how you use it and the intensity you go through with it. But I just thought that was pretty funny.
Now you have to talk about what you bought when we went to Italy the first time.
Oh yeah, so we go to Italy, and I'm like, all right, I'm gonna bring this Max Pro, and this Max Pro is it's resistance on the concentric part. The eccentric, there's no resistance. So you could do a ton of exercises with it, and the weight could go up pretty high, the resistance weight. I used it once. So we were there for 14 days, and I pulled it out once. It fit in my suitcase, it did. And
It's heavy.
it's like 15, maybe 10 pounds added to my bags. But I did have every intention on using it, but I didn't. I used it once. So
You did a lot of walking. All right. I thought this was interesting because I'm pregnant right now, and I haven't been resistance training more because I was a little bit hesitant based on pregnancy issues and stuff like that. But if you have an injury or you're on bed rest, muscle loss is very quick. It can occur at, let's say, for example, if you have a 5-day limb immobilization, it can lead up to a 1.5% loss of quad volume. If you take that into account, it would take nearly 10 weeks of twice a week training to regain that muscle. And that's pretty crazy.
yeah, I mean, I think that's probably an average. I feel like muscle can bounce back a little bit quicker than that, but it also depends on how immobile you were too. Like
Yeah.
if you're not doing anything, if you're just like bedridden, then yeah, I would definitely agree with that. But this also really drives home how fragile muscle tissue can be, and I think if there is something like that in like that you're dealing with in terms of the situation, I think there is a role for amino acid supplementation. If you know me and you've listened to the podcast and you've been reading my content, I'm not a big fan of like branched chain amino acids like thrown into your water. I am a fan of essential amino acids for people like vegans and vegetarians to make sure that they have that. But especially with something like that, I feel like having that essential amino acid supplementation along with increasing the amount of protein you're taking during those periods, I think that can help mitigate the amount of muscle loss that could accrue over that time.
Yeah, and I think the most important point there is making sure your protein intake is more than adequate.
Yeah.
I think also sarcopenia has been highlighted recently because of these new GLP-1 medications. And, you know, let's say if somebody was on Ozempic, for example, and they lost 20 pounds without any weight training, the muscle loss varies, right? So I don't think we have kind of ranges of muscle loss because everyone's a little bit different. But looking at the studies, at the high end, you could think of somebody losing up to 8 pounds of muscle. That might not seem too much in somebody who's really young who can regain that muscle if they're resistance trained. But think of it, you know, in somebody who might be 70 who's taking this medication. That's going to affect them, and it's going to affect their mortality rate, as I alluded to before, right? This puts them in the risk category of the higher risk category for falls, for hip fractures, those sorts of things, which can increase their mortality rate.
Yeah, that 8 pounds of muscle. I mean, I know if I lost 8 pounds of muscle, I would look different, right? Like my body composition. For younger kids, I think it's more of like a look that would affect them. But then the resilience, their body being resilient, being able to bounce back quickly, might not affect them that much. But like you said, getting into that older age range, even at like 50 years old, it could have a significant impact. 8 pounds is a lot, but considering that is such a huge hit. And how hard it is to actually build muscle mass, because it's a lot easier to lose fat than it is to build muscle. What do you think? Do you think like should GLP-1 medications, should they come with guidelines or like mandatory recommendations for resistance training alongside them? Should they come with like a vial of testosterone to try to like help mitigate the muscle tissue loss? Like, what do you think? What are your thoughts on that?
I think so. I think anybody who's giving out these medications should be managed by hopefully an endocrinologist who knows what they're doing and is educated in this field. And should they come out with resistance training? I think they're looking at that, right? And I think as physicians that are prescribing these medications and are trying to mitigate muscle loss and decrease mortality rates, especially if a patient, for example, has to be on it for their entire life, they're going to have to, you know, come up with some protocols that would recommend resistance training or and follow these people out. I don't know that, you know, whose responsibility that is, but if you have a good doctor, I think that they would be recommending that anyway. And they are looking at using anabolic steroids, I think, to mitigate some of these muscle loss in the research right now, right? I think we're too early still to make any kind of conclusions of whether that's going to help or not.
Okay, well, let's get back to that question that you mentioned earlier. Should doctors actually screen for sarcopenia?
Yeah, I think that's a really interesting question. And then, like, it comes down to which doctors, because we all know that a lot of primary care doctors are already overburdened. They don't have a lot of time to see their patients. I think it is an interesting question. I think that eventually it will become a screening process depending on what specialty the doctor is. I think especially if they're prescribing these medications, endocrinologists and stuff like this will become increasingly important. Um, so different sarcopenia related societies have actually come up with different guidelines to help screen, so to guide doctors. And one of them is the European Working Group on Sarcopenia in older people. And they look at the criteria and they say it should include strength, muscle mass measurements, and performance. And the performance is something that can be tested in the doctor's office, and so can the strength. So, for example, they measure strength by grip strength, and then they do things like a 5 times sit to stand test. And they see how quickly the patient can do it. Now, to a lot of young people, this might seem very simplistic, right? But if you're looking at a 70-year-old or an 80-year-old, these tests become a little bit more cumbersome. Um, so, and I would say that anybody that is on these GLP-1 medications likely should have some kind of baseline screening to see where their strength and muscle mass is. And muscle mass, for example, they measure the appendicular, the arms and legs only skeletal mass, and they do a skeletal mass index. And then, there's, like I alluded to, they do the performance. So there's gait speed, that has to be less than 0.8 meters per second. And then a short physical performance battery where they do balance tests, a gait speed test, a chair stand test, which I've talked about before, where you sit in a chair and you get up, and they do it several times to see how much time it takes for you to do it. And you actually can't use your arms when you do it. You have to cross your arms over your chest just in case, and so no cheating essentially. And then they score each component on a scale from 0 to 4 points, and the sum of the 3 components gives the final score, and it can range from 0, which is the worst performance, to 12. And like I said, this can be used clinically, and it has been used in research settings to evaluate physical function in older adults and predict disability and mortality. And it doesn't require any equipment. I think that's why it's the easiest to do in a doctor's office. It takes about 10 to 15 minutes to administer. There's other components too. You can do a timed get up and go test, a 400-meter walk test as well. But basically, there's a scoring system. So if, for example, you have 1 criteria met, it means probable sarcopenia. If it's 2, it's sarcopenia. 3 or more, that's severe sarcopenia.
Well, this is where it gets sort of interesting too, because let's just say let's just say if someone's able to perform well on those tests, would you then say that they're protected from sarcopenia, or can someone like appear to pass these screens but still experience that muscle loss that's seen, especially at that age?
So this is a very, very good question, actually. So the sensitivity and specificity you're alluding to, essentially, if we talk about it in research terms, varies widely from in the research as far as like numbers go. But basically, it is good for ruling out sarcopenia rather than identifying cases. So it's not a great test, right? It's like a very basic test. I would recommend, like I alluded to before, that somebody on these medications or somebody at risk for sarcopenia get a test like this that probably isn't great, but also get some kind of biometric testing where they either get a DEXA scan where there's an actual some kind of imaging to look at their skeletal muscle mass. And even then, there's a lot of range because those calculations are done differently as well.
Yeah, and if you're gonna do something like that, don't use like the bioelectrical impedances. Please don't do that, because we even have a couple clients that use them. They've been using them and they feel comfortable using them, so we don't tell them to stop. But it messes with their head because they're like, "How did my body fat percentage go up, even though my waist and weight went down, and I feel and look better?" It's like because that stuff is wrong. Like don't do that. If you're gonna do something where you're getting imaging, I think bod pods, I think hydrostatic testing
yeah.
or the DEXA scan would be the best options. Do you think these assessments are going to be practical for doctors to incorporate into routine checkups? Because like you said, it takes about 10 to 15 minutes to actually throw it in there. You talked about the family practitioners and how they're already overwhelmed, because it does seem like a lot, like out of those 10 to 15 minutes. But I also think it's very important if we can catch it early and get that early detection, because that could be really life changing.
Yeah, so I think you see a lot of geriatricians doing this. So people that are already, treating an older population. And unfortunately, while there can be some prevention done, their prevention should start a hell of a lot earlier, right? It should start, I think, within your 20s, 30s. You should always have consistent resistance training program as part of your routine. And so I don't know the best answer to that. I think that it should be incorporated in primary care.
Well, do you have any data where it says like at a specific age is when you should start, and then like what are your thoughts on that?
I think it depends. I think it really depends, but I don't have any data. If you're on GLP-1s, it's going to start earlier, right? The literature says around age 65.
Too late.
Yeah, but I think that muscle loss happens before that time, especially it depends on the patient, depends on their activity level, their body habitus, their, genetic components there. So I think that it behooves us to really emphasize to our patients how important, one, it is to resistance train and to have adequate protein intake. And then also, these screening tests should be implemented probably earlier than what the medical literature indicates, but that's just my opinion.
Yeah, I mean, I'm going to agree, and I'm not a professional in this realm by any means. But I would definitely say I think that's too late, because the whole point is prevention, not like trying to mask it when it happens or trying to help it when it happens or mitigate it when it happens. It's about preventing it from even happening. So the earlier you could start taking care of this, the better, especially if you are taking things like a GLP-1, which could increase the amount of muscle loss that you will experience. Now, once again, if you listen to our previous podcast, you know that both Dr. Eryn and I are fans of GLP-1s, and they're almost like miracle drugs here. But we do know the risks, and one of the risks that have been shown is the loss of some muscle tissue, and that's mainly due to what I would think is the lack of appetite and not just wanting to eat, really. Especially, you're not going to want to eat protein if your appetite's down. So, Dr. Eryn, to wrap this up, what's one takeaway you'd want your audience to leave with when it comes to preventing and even identifying sarcopenia?
Well, I just said this, so I think resistance training should be part of everyone's routine. Everyone, starting at early ages. I think in your 20s, 30s, to build that habit up. It becomes very important for females, especially as they enter their perimenopause, menopause state. So it should always be part of your routine. And the more times you can train, you don't have to be perfect. Like I said, even one training session a week can make a difference. Two is amazing. But if you are consistent with this habit, it's like having a good diet. It's very important. And then the other thing is to have that increased protein intake to preserve the muscle that you have and also build any new muscle that as you train, that you might build.
Yeah, I would actually have to agree with all of that, and I think like when you bring in the habitual aspect of doing this often, you get to a point too, as you go on later on in your life, where like if you start missing, you almost feel awkward, like, because it becomes a part of you. And that's sort of what you want. It's kind of like what I try to do with our clients, where they're doing power walks and they're hitting like a minimum step count every single day. And the reason for that is not for like caloric expenditure. It's for it to feel awkward when they don't do it. So it's a habit that stays with them for the rest of their life. And I know with how long that I've been training, and Dr. Eryn, how long you've been training, when you start missing, you feel off. Your mood changes, everything, right? So is that a bad thing? No, I actually think it's a good thing, because we want to try to have some form of resistance activity throughout the week. And like Dr. Eryn said, one at a minimum. Like, one is better than none. So if you could get that one day in, you might have a really, really rough week. Maybe a lot of stuff happened. Even if, and you know what, I don't even want to go there to that extent, because there is going to be situations in life where you might have to take a week to 2 weeks completely off. But as long as like the average consistency is at a minimum of like one per week, I think you'll be just fine. Obviously push for more. I tell my athletic clients, the ones who I consider athletes, I tell them, if you can't get, your 5 days in that you have planned, get your 3, right? It's 3 for those athletes with performance, is our minimum. For the general population clients that we have, I say 2, like try to get 2 in, but shit happens, life happens. And sometimes you can only get 1, but 1 is better than none. So on behalf of Balanced Bodies, we just want to say thank you for joining us on this episode of the Balanced Bodies Blueprint.
We are committed to bringing valuable content. And if you enjoyed today's episode, we'd greatly appreciate it if you can take a moment and like it and leave a 5-star review.
On Apple, just go to the show, scroll down to the bottom and rate it there. If you're on Spotify, go to the show's page, click the 3 dots, and you can rate it there as well.
And if you believe in the power of knowledge, share this episode on your social media to try and get the information out there to as many people as possible.
And as you navigate your own path towards better health, remember that Balanced Bodies is forever in your corner. See you all next week.
The podcast content may include discussions of medical topics and health-related information. However, the information provided should not be considered exhaustive or complete, and it should not be relied upon as a substitute for professional medical advice or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition or treatment.